planted a rose bush, and I think that my kids let the dog walk through it because it's
Oh.
most of the branches are gone.
Mm.
Oh,
I don't think it's gonna live.
All right, I think we are good to go here, guys. We see a little live on Facebook. Oh, we lost Tammy. Here she is. Well, hello everybody. Welcome to the Command Post. We are on episode number 27, and today we're going to be talking about PTSD Awareness Month. I'm so lucky to have my amazing guests back with me today. This incredible group of people were with me, I think it was in March already at this point. I can't believe it was this long ago. And we were talking about trauma and how trauma can affect military families. And I have to say, you guys totally went viral. Normally we have like 2,000, 3,000 views per episode. We got 23,000 views on that episode because your message and the stories you guys shared and the tools that you guys shared resonated so deeply with our audience. We had people contacting us, saying thank you to you guys for sharing your stories. It made them feel more comfortable to share their own experiences and maybe get some of the help that they were looking for. So thank you and kudos to you. And thank you so much for coming back to talk to us today about this really important topic. I think the more we talk about it, the better it is. So for those of you who didn't catch us the first time around, I'd like to introduce my guests. I'm going to go in no particular order. I'm just going to go around the table here. We have Sherry Oliver, who's with us. We have Pollyann Mayer. We have Tammy Murray. Tabitha, I have no idea how to say your last name. I should have asked you. How do you say your last name? Bainan?
Bainan.
Okay. Rich, your last name's not on there, but
It's bride, like when you get married.
Perfect. And we have Diane Oliver. And Diane is actually Sherry's mom. So we're a bit of a family affair here today. So thank you all. I think to start us all off, what I'd really like to do, just like we did last time, for those who missed it, is kind of start talking about what your military experience looked like, how you're associated with the military, what your military family looks like, and what brought you here today and what your life kind of looks like today, if that's okay. And I know we're not all necessarily military, but we'll get to that. Tammy, I'd like to go last with you if that's okay, because I'd love to tell everybody what it is you do and how it is that you help others. So Diane, I'm going to put you on the spot if that's okay. Okay. We're going to go to you first. And if you can tell us a little bit about how long ago you became part of a military family and part of that journey.
Married my husband in 1963. And we were both in the Navy. We were both communicators. He was signalman, and I was a radio operator. And where do we go from there? Let's fast forward to meeting Polly.
So we just jumped a whole lot of years.
we have this terrible, black, yucky, mucky, horrible time for 42 years.
So, okay, let me go back for a second and ask you a few things without going into the yucky and mucky. What is it that your husband was doing when he was in the military?
I'm sorry?
What was it that your husband was doing while he was with the military?
He served 31 years. He started out as a signalman. He got out and he got his engineering and he went back in. And he ended his career as being hangar chief out in Pat Bay. He opened up the Pat Bay hangars.
And were you one of these families that moved around quite a bit?
Yeah.
So tell us about that. Where did you go?
Moved 27 times.
What? How did I not know this?
There's moving stamps on everything. Probably still is on that chair, eh, Sherry?
I think so. If I look underneath.
And and I once fooled around and I said I'm going to have to tell everybody I'm going to write a book, and it's going to be entitled "The Screwdriver's in the Drawer, in the sock drawer. Where else would it be?" Because when you're moving, the last thing that goes out is the drapes and the tracks.
Right.
But the screwdriver's in your hand. They take the drawers out to move the dresser and they leave the drawers there. So you put the screwdriver in the, where else would it be but in the sock drawer?
Of course. That's where I'm going to move it after this show, just to.
So that was time. We moved a lot. They moved a lot. They cried a lot. They didn't think they'd make friends anywhere. And then there was the time that we left Sherry. Poor Sherry. Anyway, she needs you, Tammy. We got drafted to British Columbia, and she was just finishing high school, and so she was 18, and we left her behind because she would not go with us.
Right.
So
I
she had a job at the Navy lake. They got a man-made lake that they practice helicopter runs on, and she got a job out there as a lifeguard. And I made her put a great big red flag on her bike, which she hates me to this day for. But it was hard moving out there. And my son did the same thing. He joined Royal Military College because we were drafted up to Bagotville, Quebec, and they didn't have any high school in Bagotville, Quebec. So they informed us that our family would have to go up there either without the children or hire our own tutors up there. And they both pitched a fit, and Sherry decided to stay and work there because we weren't going to Bagotville. So they said, well, you'll have to go to BC then. Oh, that's good. We'll go there.
So was it just you and your brother in BC, Sherry?
No. He stayed
Oh.
back. He finished his grade
Yeah.
12 in Saint Jean, Quebec, and then went into Royal Military College.
Okay. And Sherry, so Sherry is Diane's daughter. And Sherry, tell us about your experiencing growing up as a military child and moving 27 times.
I think I blocked many of them out. But yeah, we moved a lot. The experience was very coordinated from a moving perspective. They just march in and pack everything, garbage included. If you had it in your room, it was in a box. Yeah, it was just all done in one day. And yeah, it was very hard making friends because you would just get to know people, over a 2-3 year course, and then you're leaving them again.
Mm-hmm.
In retrospect, it was a really good experience because you got to meet so many different people from across Canada, people who have been to Europe, people who've moved all around all over the place. So, looking back on it, it wasn't necessarily a totally negative experience. Yeah, but it wasn't easy.
Okay. And where's home for you now?
I'm in Cambridge now.
You're in Cambridge now.
Yeah.
Okay, Rich, let's go over to you. How did you end up in the military?
Sure. So I was 26 when I joined the military. I heard that there was adventure to be had and good pay. And the recruitment posters looked pretty cool. So I joined the military, and that was in 2006. I was posted to the Royal Canadian Dragoons, which is an armored regiment, in 2007, and I was an armored crewman. So I started out as a driver of like an armored vehicle, not a tank, but like a big tank looking thing with wheels instead of tracks on the bottom. And then I graduated to become a surveillance operator and operated a bunch of electronic equipment in the back of the thing. And I deployed to Afghanistan in 2008, and I was there until 2009 for about 8 months, I would say. And then when I came back, I was diagnosed with PTSD in 2010 after I noticed that my behavior was changing. I was having just a lot of difficulty that I wasn't having before. And so I was diagnosed with that, and then I did a whole bunch of therapy. I linked up with some social support, like the operational stress injury social support system, OSIS. And so now that I've been out of the military since 2018, I've started actually volunteering with them, and I do a little bit of peer support, and I run an online support group for a few people in Southern Ontario. And sometimes I go on podcasts.
That's awesome. And you're married? Children?
I am married. Yeah, I've been married since 2003. So before the military, and we've been married the whole time. We didn't get remarried after anything. And we have 3 kids at home with us. It was only supposed to be 2, but then COVID sent one back from university. So now we have 2. And so yeah, we live just outside of Stratford in Ontario, a little town called Mitchell, and it's not too bad.
Fantastic. Thanks, Rich. Tabitha, tell us about your military journey. You were actually serving. Tell us about that.
So I joined the military in 2006, just like Rich. I was actually going to apply to the nursing program, but I'd already done 3 years of college and decided that I didn't want to do any more school. So I switched and I became a medic. I have a lot of friends that were in London in the reserves, and one of them happened to be a recruiter. So that's how I got in the military.
You got sucked in.
He recruited me. He's really good at his job, apparently. So yeah, I joined the military in 2006. I graduated my medic course in 2007, and I got posted to Petawawa. I went to Afghanistan in 2010. Then I went to Shiloh, Manitoba. Then I went to Saint Jacques, Quebec. Both of those postings were clinical rotations. And then in 2016, I was medically released for a physical injury. And then in 2017, I was actually diagnosed with PTSD. So my diagnosis actually came post-release. So did my symptoms. And yeah, so I spent 10 years in the military as a medic, and I now live well, not at home. I did just live with my parents for 8 months because my house is under renovation, but I have a house just outside of Strathroy, which is just outside of London. And I have a 7-year-old.
What does your family look like? Do you have a son?
Yeah, my son will be 7 at the end of the summer. Okay. And I co-parent him with his father. He is also ex-military. And we live, luckily for me, we live fairly close to my family. Unfortunately for the other side of the spectrum, my son's other side of the family lives in Manitoba. So yeah, it's that's the distance.
End of a trek, yeah. Awesome, yeah. Thank you. Polly, let's go over to you. Tell us about your military family journey.
Sure. So my spouse was in the military for about 7 years. He was actually with the RCD, the Royal Canadian Dragoons as well, and a crewman and a tank driver. He actually drove the tanks, the old tanks. And he did a tour in Bosnia in 94, 95. And he decided to get out. It was the end of his second contract. And, we were a young family. 3 weeks after he came back from Bosnia, we had our second child in Petawawa. So we moved, I think 3 or 4 times while he was in the military. We were in Germany. That's where we got married. And Ottawa and Petawawa. And then we moved back home. Home is Stony Creek in Southern Ontario because we wanted to be close to family and stuff. And probably about 6 months post-release was when I noticed sort of these crazy like symptoms. I'm going to say because I didn't know what they were, but he was hypervigilant about locking the doors. He was hearing noises. He was sleeping with a knife under his pillow. He was very aggressive. And so that went on for about 4 years, and he coped by drinking and drugs and, went to the family doctor, but nothing was ever associated with military. And in 1999, he met a fellow veteran in a bar, and they started talking, and this person had been on the tour just before him, was a Strathcona, so that's the Armored Corps, but out west. So they knew some mutual people. That's how, the conversation always starts. And then he started asking him about how he was sleeping and different things. And he was like, how are you in my head? And, so that whole conversation, he says, you need to go to Veterans Affairs. And my husband was like, well, I'm 31. Like, I don't need to go to Veterans Affairs. I'm not a veteran. He's like, yeah, you're a veteran and you need to go to get help. And so that was our gateway, peer support before there was official peer support. And so it was a roller coaster after that. I mean, I was like, yay, there's something legitimately wrong with him. He's not just, being not nice. I'm going to use a nice word. I'm not going to swear on here, but but it was still a real roller coaster, and he tried a lot of different treatments. I've been fairly lucky in that he's always kept me involved as part of, you know, his team, although we didn't always agree on everything and we didn't always get along. But I always, you know, was looking for different treatments and starting to research and realizing that how much it had impacted myself and my kids along the way. And so in 2009, I went back to school through the Veterans Affairs vocational program because he couldn't. So I went back for social service worker. And then I started volunteering with the OSIS program as well in 2009, 2010. And then in 2011, I was lucky enough to get a job with the Operational Stress Injury Social Support Program. So I've been with them 10 years on the family side of things. The thing that I find the best is that I could take a really crappy part of my life and use those experiences in a positive way to help other families and help the road be less bumpy.
Well, you've just done our whole show. So, so guys, thanks so much for, no, that was amazing. Thank you, Polly. That was tremendous. Thank you for sharing all of that. Tammy, let's go over to you. You're new to this panel. Tell us a little bit about your journey and what it is that you do to help those who have PTSD.
Well, ironically, I am actually a military brat. My dad was ex-Navy. He's a veteran of past, obviously. He was in the Korean War and got out shortly after the Korean War. And if I knew what I know now, I would have been able to help him a great deal more, considering he was a raging alcoholic for many years. Luckily enough, was sober shortly after I was born and was sober until the day he passed for about 50 years, which is pretty amazing considering. So, and as well as my nephew and my half brother was actually a lifelong military member as well. So, but enough about my family. More about me. I actually am a clinical therapist. I am a former family liaison officer. I used to work with the Integrated Personnel Support Team, which is now the transition team via the JPSUs, which I believe has also been renamed. So in 2012, I left psychiatric medicine and decided to venture into a different area of my career, which was working for the London, or now what is called the Southwestern Ontario Military Family Resource Center, which is how I got connected with Polly, as very quickly upon I recognized that Polly was a very significant person. One of the roles of the family liaison officer, or primary duty, is actually to work with the families of the fallen and the injured. So that essentially means anybody medically releasing in their journey, or anybody who might be post-released who may be experiencing issues, to kind of help them navigate the system as well and get diagnoses, etc. And obviously the worst part of my job was to work with families of the fallen as well, to provide grief counseling supports, as well as benefits and resources for those families as well. And currently in 2018, I decided to stop commuting for 30 years to London, Ontario. I live currently in Woodstock, Ontario. I have two beautiful teenagers, and I decided to open a private practice. And one of my primary niches or areas of expertise obviously is operational stress injuries. So I do work with a lot of veterans and a lot of family members of veterans, and connect them with appropriate resources that I think sometimes maybe people who may not have inside information in regard to working with veterans or Canadian Armed Forces members may or may not have. You know, and I'll give you an example. I was talking to a case manager at VAC the other day, and she was looking for a progress report on a client, and I had mentioned that we had just gotten this client a kayak through Soldier On. And the case manager went, "You can do that?" And I'm like, "Yes, you can." And so, you know, sometimes it's also advocating back to the other resources that are working with our veterans, just to widen their lens of what resources are out there. So hopefully that is what I can provide for you all today, is just if you have any questions or any resource information or anything you want to clarify, I'll certainly kind of be on the peripheral for that.
Fantastic. Thanks, Tammy. We're gonna talk a lot about resources and coping tools. I'd like to start with sort of going back to the basics here and talking about the PTSD and how it manifested in your own lives. Now, one of the things that Polly has really taught me, and I think it's really important for our viewers to understand, is that when we talk about treatment, and Tammy and Polly, please correct me if I'm wrong, when we talk about PTSD, we very much don't focus on the event. We talk about the journey of of the healing, if that's correct. I'm going to put it to you. Is that where we try to focus when we have conversation? I think there's a lot of individuals out there that want to talk about their own PTSD or want to are curious about others, but they don't know how to start that conversation to let them know that it's safe for them to share their stories.
So I think if I can chime in, really in regards to peer support and OSIS, one of the things we talk about is we don't talk about the event because you don't want to trigger someone else, but you're talking about how has that event or that traumatic experience impacted your day-to-day living, and how does it continue to impact, and what are you doing for resources and stuff. Tammy, on the other hand, she might dig as a clinician, she's going to dig deeper into that trauma piece in an individual basis. And I'll let Tammy.
Sorry, go ahead, Tammy.
Well, one of the things, depending on where somebody is in their trauma, we have to be really conscientious, right? Sometimes you have to be aware that you're not going to want to open, if I could metaphorically say, Pandora's box before somebody has the stability tools to do so. So if somebody's chronically drinking or abusing drugs or alcohol, of course, we're not going to do exposure therapy. We're going to, as I think as Polly said, we're going to look on the skills and what can we do to get them to a stabilization place. So if they're ready, when they're ready, we can start to look at Pandora's box, because part of the component of working with trauma is what we call exposure therapy, which does mean bring in a safe environment, in a grounded environment, which does mean talking about those situations, but we don't stay stuck there. And part of the reason we do that is neurological. One of the things that we do know about trauma is we will disassociate. And I think somebody said earlier before we came on air, in terms of working with ICU patients and pushing it down and pushing it down and pushing it down. And as humans, we can only push down for so long. And it comes out in lots of other places that sometimes we don't realize, right? So I think that's the other place where we're looking at how do we get that stability so we can get to a safe place to work with those issues, because safety is key, right? Because we're so vulnerable when that trauma and which is the PTSD. I will interchange that just because the trauma relates to PTSD, and then comes down those other symptoms of depression and anxiety that trickle from the post-traumatic stress syndrome.
So I have a couple questions to follow up with that, but before we do that, if we're all comfortable doing this, again, not necessarily focusing on the event that triggered the PTSD, but Diane, if you don't mind, if we start with you, can you talk us about how, now you were diagnosed with PTSD and your husband was also diagnosed with PTSD. So a couple questions there. Number one, how did your PTSD manifest itself? What was happening in your life before you were able to get some tools to help you?
I think Sherry can attest to it. It was just years and years and years of non-communication, dysfunctional, I think is the best way to put it. We survived. The only way we communicated was fight. And you're going to do this and you're going to do that. And we were both strict parents, military. You had to do this and you had to do it this time and this way. And so it was just cold, cold, oppressive, angry, quiet.
And could you recognize in yourself at the time, before you managed to get yourself some help and your husband some help, could you recognize in the time that there was something not quite right, or it wasn't resonating at all?
I knew. I had been, well, like I said, 42 years. And when the thing happened, Jim started drinking heavily and I started fighting his drinking. And you know what that does. So that's years and years of dysfunction. I got lost there. Where are we going? This happens.
No, that's okay. This is really important.
Yes. So I was trying to get us help. I was trying to reach out to anybody, anything, come help us. We are suffering here. We don't know. And all we could see was we were fighting all the time, or drinking, or like that. And the whole family thought, because they said, I was the only one that would go. I went to doctors, I went to psychiatrists, I was sent to all kinds of treatments because I was sick. They said, she's got a problem.
Right.
And I kept fighting. It's not my problem. It's the whole thing. Now, if that's seeing something's wrong, well, then I did. But what it was, I had no idea.
You didn't
And
have a name for it.
just the way, just the way it unfolded. One of the crew members asked Jim to tell his story, and he wouldn't even talk to him on the phone. And I answered the phone and I said, he's not going to talk to you about that. And so this is when they said, well, do you know what happened? I said, I know every damn thing that happened. I was in the message center when it happened. So that's how I started talking. And so we went into the military, the VA in London, to help Jim, because I was his problem.
Right.
And he had to share this, you see. And so they called me in to tell the story. So I did, and they said that I should get a claim of my own. And what for? You know, I could not see that I was worthy of any kind of help. I was too broken. I was too work on them.
And Diane, had you known at the time, seeing that this was a number of years ago, were there resources out there? Were there individuals you could talk to, or was it sort of a fend for yourself situation?
No, the official diagnosis was female hysteria. That was a diagnosis back in the day, and they gave me every kind of pill for every kind of. There was years that, you know, I just didn't know who I was or what I was. I was being medicated because I had a problem, but they didn't know what. And so after about 10 or 15 years of this, I just buttoned up. I just forget it. Right. And then about 10 more years after that, I found the Lord found me, and that broke the family up too.
Right.
So I didn't know what the problem was. And they were all back. The family was still, she's got a problem. Now she's a religious lunatic, you know. Oh, goody, I got another label, you know. So anyway, when we went to London, I heard this PTSD, and they had me go see their psychiatrist.
To clarify for us, where did you first hear the term PTSD?
In London.
In London, where though?
Help me.
It was about 2011, give or take.
I think you were at Veterans Affairs and you went to the OSI clinic.
Okay.
Yes, but I would think it was just then being called OSI.
Okay. Yes.
And even now, PTSD is called OSI.
Right. And so you hear this word for the first time.
I didn't know what it was. So anyway, the psychiatrist there said I had PTSD, and he signed all the papers, and that was that. So I went home, and I didn't know what it was. And I thought, well, this is just jolly, isn't it? Another label that they can pin on me. Now they'll point and say, she's got this. And I'm used to being called all kinds of names, and insane was one of them. Anyway, I was looking anywhere on the internet, and I found a lovely article. That day, National Service Dogs opened up a new program for vets with PTSD. And if you were a vet and you had PTSD, the diagnosis, they would give you a trained dog to help you. And here we go. So I went knocking on the door in NSD, and I said, you got a dog for me? And they said, oh, do you know a vet? I said, yeah, I am a vet. And it just to convince them that I was a vet, I had proof and go through all the hurdles and everything else. Anyway, that opened up a new light for me. I started looking around. I heard PTSD. By then I was too, I'm outspoken anyway, but people didn't talk about those things, you know. I have always talked freely about my mental health. Okay, so I'm nuts, call me whatever. But I am so happy to find out, oh, it's only PTSD.
So I want to come back and I want to talk to you about what that meant and how life-changing that diagnosis and the information you were finally getting, what that meant to you and what that meant to your life. I want to go over to Sherry for a second. Sherry, so you had two parents suffering from PTSD, not knowing that they had PTSD, not aware that they needed to get help. What's that like growing up in that kind of household, and how does that affect how does that affect you and your brother growing up? And I know this is really hard to hear for you, Diane. So thank you for being so vulnerable and allowing us to talk about this.
No, it's actually was something we talk about. So it's not, no, I don't think it's too traumatic for her anymore now. I think it's probably more helpful. I was a little bit of a rebel, so I didn't really, I knew my mother would sleep a lot. I know she'd be very angry. I know that if I did something that I wasn't supposed to do, or if I wasn't home at a certain time, she would come find me. There was no question about that. I was just doing my own kind of thing, and I don't know if it was a protectionary thing for me to just kind of find my own way to not get involved in whatever the hell their trauma was, right? Like, I don't know. And when Mom was talking just now, it's kind of like you don't know what you don't know.
Mhm.
So, you know, when you're not feeling very well, if you're having a bad day or something, someone will say, you know, what's wrong? You're like, I have no idea. I don't know what's wrong. I can't pinpoint it, because it's usually not just one thing. I think it wasn't until, around 2011 when Mom and Dad really kind of honed in on like, oh, this kind of thing happened, and oh, that makes sense. It led to this and it led to this, and oh, this is why we're doing that. And this is, you know, it's not like it was a total answer to what was going on. It was just like, oh, that makes so much sense. You know, hindsight is 2020, right?
So your mom comes home and tells you she's been diagnosed with PTSD. What does that mean for you now? Like, how does that change your relationship with her? How does that like you said, like hindsight's 2020, like what's your thought process on that? And does it open up does it allow for a more open relationship with your mom, or was there still a lot of stuff?
Oh yeah, totally. Yeah. I mean, we had fought and gotten our sillies out years and years ago, I think. But this was just another kind of added step. And I think over the years, we've actually been very close. I mean, contrary to what Mom says, I mean, we grew up, I thought it was fairly kind of normal. You know, I played violin. She was at all the things. I wasn't allowed to go to dances, and, you know, it was fairly normal for me. And especially in a military family, it was normal to have fighting, to have drinking, to have, but it isn't.
Right. It's what you knew.
And then when they were finally diagnosed, I you know what, I honestly don't know the answer to that. I think because I'm still kind of processing stuff for myself.
Mm-hmm.
You know, that's a lot of years of strange, different, weird, unanswered questions, behavior, you know, not only their behavior, my behavior.
Mm-hmm.
So yeah, it was kind of a relief, only in that they were actually able to reconcile something for themselves. They were actually able to find some sort of support and be able to address it. And, you know, I think I said this in the previous one, you know, lady, she was just a lifesaver for, you know, our family. Yeah. She was a lifesaver.
I want to come back and talk about what that means, because I know that there are that I've heard from many people that in certain cases these the support animals can be really life-changing. Rich, can we go over to you for a minute and talk to you about, you know, again, not necessarily the event that triggered the PTSD, but how the PTSD started to manifest. When did you know something wasn't quite right, and how is it coming out and potentially affecting your family?
Sure. So I was overseas in 2008, and I guess we had a little bit of preparation beforehand, because they told us what some of the symptoms might look like. You know, not being able to sleep and having, you know, memories that you don't necessarily want popping into your head, that sort of thing. And they also mentioned that, like, you know, you can have a stress reaction which lasts for, like, you know, sort of a certain amount of time. You know, I don't actually know what it is. It's 2 weeks, 4 weeks, I don't know, something. And then you have a disorder which kind of lasts a lot longer than that. And so when I was overseas after the thing that caused the injury happened, I wasn't able to sleep. I wasn't able to close my eyes very much. And I sought help kind of right away in theater. They gave me some medication. They set me up with some like therapy. There was a mental health nurse right in location there. There was a psychiatrist that was down in the main base, and I got to see them once in a while. So and then so then I came home and
Sorry, Rich, can I interrupt for 1 second? Were you still being asked to serve during this time, even after recognizing that something wasn't quite right?
Yes, and it was voluntary though. They said, "Do you want to go home?" And I was like, "No, I don't want to go home. Like, I don't want to leave all the people that I trained with, and I came here to do a job. I want to do the job."
Right.
So, you know, they said, "Do you want to go home?" But I said no. So I probably should have said yes. But so I did actually get some treatment right in theater, and when I came home, I was continuing to take the medication that was helping me sleep, and I started noticing that I was getting angry really easily and for absolutely no reason without being able to calm down. And I said, I can't live like this. I have 3 small children. I can't do, like, this isn't. So they said, go get help. They said, go get help. So I went and got help. I went to to some therapists. I ended up being put on a medical category and having like more limitations at work and not being able to do a lot of stuff. You know, basic military stuff, drive a vehicle, handle a weapon, go to work. That sort of really basic stuff. I was being restricted by the medical system. And so I went to lots of treatment. I went to different hospitals. I was in a rehab center for a while because I had started self-medicating. And by the way, you talked about how, you know, usually you don't share about the event. It's more about, like, you know, the challenges you're facing now. When I was in that rehab center, which was a PTSD specific treatment, like, you know, that we were in, we went to groups and I would try sharing stuff and they're like, stop, you can't talk about this in this treatment group because you're gonna, you know, cause other people to have issues too, not even just trigger other people, but you're gonna, like, you know, cause issues. You can't say this stuff. So you really have to, anyways. I basically was left with a choice at that point where I could continue the treatment and lose my military career. The doctors pretty much told me that, like, you know, you've been in treatment for this long, and if you're not better, you're gonna be released. And so my choice was to continue to get better and keep my family, or continue to not get better and keep my military career. And I chose my family.
Is there, you know, I'm going to come back and ask a few of you this when it comes to stigma, but I mean, there's got to be a really difficult time for individuals to disclose that you have a mental health issue, that you've been diagnosed with an OSI, knowing that it ultimately means the end of your career. And they give you this, it sounds like you're given this sort of ultimatum. Is it a healthy choice? Does it feel like you're being strong armed? Like where's your mind at in this particular scenario where you feel like you're giving up your career?
So I don't think that it always means that you're giving up your career. There was a lot of things for me. I had landed in the hospital several times due to trying to die by suicide. I had addiction as a complicating factor. I had been in treatment for several years. And so, I mean, and the risk of relapse for me was quite high.
Mhm.
So, I mean, looking back, I it hurts it hurts me a lot to think about it, because I fought against it for so long. I really wanted both. I wanted to be able to have my treatment and then continue my career.
Right.
And so I don't think that it ends a career in every circumstance. I don't think that that's the case. And So I wouldn't want to put that message out there, but I do think that you have to keep in mind that that it's not like other things in the military. Like if you rip your shirt, you go to the thing, you get a new shirt. That's easy. If you break your tent, you go to the thing, you get a new tent. They give you a new tent, you put it up, it's there, it's great. But it's not like that. Like you don't just go to the psychologist, the psychiatrist, the mental health nurse, the social worker, and then they give you the thing that you need, and then you go back to work.
Yeah.
It's not. Everything else in the military is almost like that, but this is not like that. You actually have to do something. You actually have to do some work, and I wasn't able to get that until it was too late. If people who are able to say though, like, hey, I need to actually do the things that are being said to me, even though I don't want to, whatever, it doesn't matter. I need to do these things, then you're going to have a much better fighting chance.
No, that's really important
But
to distinguish. So thank you for that.
sitting around and waiting for other people to fix you it takes a lot longer.
So that's a really good message for tonight. So thank you, Rich. Tabitha, let's go over. You had an interesting situation because your PTSD did not start to manifest until after you medically released for a physical injury.
So in hindsight and lots of therapy, my PTSD was very present for a lot of years. It just presented differently than what I understood PTSD to be. And that's one of the things through my journey that I do a lot of these presentations, because I wish I had known back then what I know now, I guess would be the best way to say that. My symptoms started to manifest in 2010. But my symptom was numbness. So disassociation from pretty much all life events that were even remotely difficult or traumatic. That was where I went. I was called resilient. I was called strong. People used to tell me, oh, if I went through some of the stuff that you're going through right now, I'd be in a straitjacket. All of these things. And I was like, I'm fine. Like, no big deal. Like, it's, it's life. It's what's handed to me, and I'm just going to deal with it, and I'm going to carry on. But in hindsight, it was just, I was so numb. I felt nothing. I literally had not the positives or the negatives. And when I did, they would be classified as like extreme positives or extreme negatives. But to me, they were just like, oh, okay, I'm happy today. Or, oh, okay, I'm mad today. Whereas like for other people, they would be very big emotions. And so that was for, the last 6 years of my career, basically, that I was experiencing that. And, to everyone else in the outside world, it was just resiliency is what they called it. And then when I got out, I was suffering from what, everyone called mild depression, which it made sense to everybody. I had a lot going on in my life outside of the military. Like there was a lot of personal things going on. I was transitioning out of the military for a neck injury and those kind of things. And then I got to move home. And it was a blessing and a curse, I guess you could call it. The second I got home, it was like I didn't have to be responsible for everyone and everything. I had people that were there to help me and support me, and I completely fell apart, but only on the inside. So what people saw, other than I was very blessed. I came home, I lived with my little brother for a while until I could figure out what exactly I wanted to do and where I wanted to land. And he was the only person that actually experienced my symptoms. He was the only person that saw it. And he was very respectful of where I was at with that. I went because my case manager at VAC wanted me to be assessed. And that's why I went to the OSI clinic. I didn't think I had PTSD. I didn't believe that I had PTSD. Even when they told me I had PTSD, I was like, are you sure? Like, I called my friends that have PTSD. I called many of them and was like, I don't understand. Explain it to me. because nobody told me this, like what's going on kind of thing. And, like a lot of them are actually still serving. A lot of my friends that have PTSD are currently serving still in full capacity. So yes, like it's not a career ender for sure. It can be, but because I didn't know you don't know what you don't know, like Sherry said, you don't know what you don't know, and I didn't know. And in hindsight, yes, I wish I could go back to those days because my journey would have been a lot easier and a lot shorter. The longer, when it gets drawn out like that, a lot of times it's a longer healing process because there's a lot more. We don't even call it Pandora's box. Mine is like this volcano that just randomly erupts and just like explodes. And then I, have to kind of unpack what's come out that week or that month. And then we have to unpack that for a while. And then we just like, it's like almost waiting for the next eruption to happen for those things to come out because they've all been pushed so much. And so that was the thing. Like, if I hadn't have had symptoms of depression, no one else, like my case manager, she's really what got me to where I am. And so, yeah.
I'm so glad that you're shining a light on the fact that PTSD can shine itself in so many different ways. I think that's so important for people watching tonight to know that not everybody looks exactly the same when they're diagnosed. I actually want to go over to Tammy for 1 second before I go to Polly. Tammy, okay, so we're learning that PTSD can look so different for everybody. Does the event itself, when we're looking to treat, when we're looking for resources and tools, does the event itself dictate how you might go about treating? Or is it, tell us where you start when somebody is diagnosed with PTSD?
Well, I think we just so eloquently kind of got a description that usually it doesn't present directly as PTSD. If it was that easy, then we'd have a lot less clinical practitioners in this world. It'd just be a tick box. I think a lot of times family members will pick up on it. And again, think about it. Military members are trained, and it's interesting you use that word resiliency, to be highly resilient. And weakness is stigma. There's no room for weakness in the field. There's no room for weakness in your job, as all of you sitting here know this. So there's almost that resistance, even if you are experiencing things around. Now, I have to say, in the last 5 years, that has decreased significantly with some of the teaching and the training that's going on in the military. But somebody noted that it wasn't until about 10 years where we actually had this label, 10 years ago, where we had the label of an OSI. So we didn't even acknowledge, prior to that, if you had a mental health illness, you'd be kicked out of the military. You were either green, good to go, or red, no. That was the bottom line, right? Now we have the mental health continuum, which I think is keeping a lot more people in service. The challenge is it's the behaviors and the self-medicating. It's the other stuff that tends to bring people. Ironically, being diagnosed post-release is not an unusual phenomena. It's actually much more common to be diagnosed probably 2 to 5 years post-release than it is while you're in. And the reason being is nobody's going to the MRI or the MRR to get diagnosed with a mental health issue because of the history of stigma behind not having a job in the military. I mean, trust me, they'd see me and they'd run backwards. Like, I have power, like I think Tabitha said, or someone said earlier, Richard maybe has said it, things like removing a gun or you can't drive. And so there are some, perceptions of negative outcomes that will occur if you do seek help. Right. Although, Rich, I have to applaud that they did treat and do something in the field. I'm going to be honest, it's the first time I've heard that. That is absolutely incredible and amazing that you were able to access that. But I think your point was interesting, Stephanie. But you were still expected to do your job. And what does that look like? And that can also pile on to the symptomology leaving. It's like, okay, well, here I get take a little pill and I'll just move forward. So am I surprised that self-medicating came into play? Absolutely not. I'll take a pill, I'll drink some wine, or I'll numb, and I think Taba, you nailed it, that whole numbing component, right? And part of that is also a bit of your training, especially when you're in the CAF, right? And that is also the difficulty for family members around that training, because we haven't had that training. So, so it becomes a bit of a conflictual issue as well, right? That, and understanding it. And, and I think Polly nailed it in terms of we almost have to go on this exploratory journey to understand, because it is different. And it is, it will present differently. Women tend to, and I hate to be stereotypical, I really do. If anybody, you all know and love me, I hate doing this, but women tend to withdraw. We tend to minimize. We'll be like Tabitha said, I'm not surprised you didn't, well, no, I don't have PTSD. I'm just, I just had a bad day. That's it. Right. And then we contrast with, kind of the mad guy in green, right? That anger. And a lot of times, because I also do a lot of couples work, that anger is anxiety. It's worry. It's fear. It's hypervigilance. And the minute I kind of put that on the table, and it's interesting, Sherry, that, I was thinking of you and your mom when you were talking, it's almost like in 2011, there's this pivotal rationale that we can empathize with a little more and not be defensive with. It's almost like, okay, I don't have, I can be more empathetic. This is anxiety. It's not that they're mean or they don't, they're angry at the world. They're just, they're sick. And we're not going to, beat up somebody who's sick. We're going to look at it differently. And I think if we just widen that lens, wow, we get such a different perspective and view. And I think, and I also think it helps when we get that diagnosis. And I think that we have so many people in the room that can attest to that. It's like, okay, all right, at least I have now something that makes sense to me, and that I can do something with. And there might not be one resolution. Absolutely not. And that's the other thing. The treatment may vary person to person, depending on the symptomology, and if you don't mind, if I kind of use the room here, guys, Rich needed to go through some of his self-medicating stuff, which was the barrier to actually get to what was going on with his trauma and PTSD. He was masking that, right? And then, you go to Tabitha, who's very highly defended and guarded, known as resilient, who doesn't want to be vulnerable to that pain. So I'm just going to hold that, here. And then you have poor Diane, with all due respect, who didn't even have the resources or knowledge to know it was wrong. And I remember meeting Diane in 2012, shortly after her diagnosis. And she nailed it. She was angry. She was not just angry that she didn't understand it, but she was angry that it went for so long and they didn't have the tools. And, and I remember, if you don't mind me sharing, Diane, our first encounter was, literally, prove it to me, Tammy. Prove it to me, teach me, and get, and by the end of the weekend, I mean, I can't say I have any bigger hero in the room than Diane Oliver, because, given the years without the treatment, given the years without the knowledge, and then here we are, 2011, and for Sherry as well, and how that can trickle down and kind of being, okay, yeah, it wasn't, it's funny that Sherry, you nailed it. It's almost like, well, I didn't see it as unusual. Most of us don't see dysfunctional families as unusual. We don't know they're unusual. It's kind of like, I didn't know I was poor as a kid until somebody told me I was poor. Right. Right. And so we don't understand it until we, and I think the other part of that is when we do start to understand it as adults, we do start to resent it. And, so having that bridge for Diane and her daughter to be able to have a different outlet for that communication and widen that empathy, I think is huge, right? Mm-hmm. Because we could just hold on to that anger and Diane could respond with that anger. And, I think it's just about letting some of those walls down. But until we know what it is, it's hard to figure out. And so it does vary. I guess a long answer to your questions, it does vary for person to person. It also will vary depending on your background. To Sherry's credit, she also grew up with highly resilient people. So I'm not surprised that she's like, I didn't think anything was wrong. It was normal, because in our family, we trudged through stuff. We solved the problem. We nailed it head on. And we just go through until we're looking back at it and going, wow, maybe mom and dad did drink a lot. Wow, that did seem dysfunctional. But now at least we have an umbrella of understanding for it. So it does vary. And it does vary depending on sometimes the extent and perception. Remember, PTSD and anxiety is, from a diagnostic perspective, based on our perception of fear, real or not.
Right. So
a lot of this can also be accentuated by perceptual fear as well, which is typically what happens with PTSD post-release, right? I think somebody mentioned hypervigilance, right?
That was making me think about Polly, and Polly was talking about how her husband was so hypervigilant. Polly, tell us about, thank you, Tammy. Tell us about, a little bit more about how your husband's PTSD manifested, how it affected you, and what that sort of journey looked like, and when you finally had a name for it, when you were finally able to say like, oh my God, I know what this is, and we can do something about it.
Mm. So those first 4 years after he got out, they were very trying and very, we had moved back home. We were really one of the only married couples of, his friends and stuff. So he was still going out like he was single, and I was home with the kids, and, that was just the norm at that stage, but the drinking and the hypervigilance and road rage and things like that, that's where, the red flags were going up. And he did go to our family doctor, who gave him sleeping meds, which, he abused the sleeping meds, right? Because that's what you do, right? And so, fast forward to 99, where he got diagnosed. Again, it was a relief. But I was very naive in the fact that I thought, okay, so they're going to send him to a psychologist, psychiatrist, they're going to fix him. They're going to fix him, right? That, because I didn't know anything about PTSD. I mean, they never told. He was on a UN peacekeeping tour. I didn't really know what went on there. There wasn't lots of, media coverage and everything like that. And so, once I realized that that wasn't the case, he wasn't going to get fixed by anybody else, I kind of dove into my own, like, let's get books, start reading, start stuff, things like that. And one of the first counselors that I saw through where he was working at the time, he was a crane driver. And so I went through his EAP program, and she said to me, let's talk about grief. I think we really need to do some grief work. And I was like, okay, well, nobody died. Like, I don't understand this grief work. And she said, well, you need to grieve the husband, the father you anticipated, the life that you had created in your head. It's different, right? And so for me, that was really a turning point. And I mean, don't get me wrong, I went through years of resentment as well. But it did help me kind of manage my expectations better. So if anybody knows me in my job with OSIS, the first two things I talk about is perception and expectations, right? Because we all perceive things differently. Still in our household, he perceives things differently than I do, sometimes through that PTSD lens, sometimes through it's just a men's lens, and distinguishing those two. And Tammy was sort of my first conduit of that. I remember calling her once and complaining about him, and she goes, this isn't PTSD, this is normal couple stuff. And I was like, damn, because that's the thing with PTSD, everything gets blamed on it as well, right? Once you have it. So it's like, what is normal, like, quote normal, what is normal in a relationship, in a family, all of that kind of stuff, right? So for us, it was a real journey. And like Rich, Sean went to Bellwood, he went to Homewood. He was in the psychiatric ward here in Hamilton for suicide attempt. He did abuse medications and stuff. And I can't say it was any one thing that, boom, the light went off, but it was a lot of little things. And it was the realization of the impact on the kids and I, because, my kids were scared of their dad. Like, I mean, he could just yell and you could see the terror in their bodies. And, we did a lot of family counseling when the kids were sort of starting teenage years, and it really helped. It gave them a voice. And that's also when I started to realize that I was taking care of everybody, but I wasn't taking care of myself. So, I was everything to everybody else, but I was nothing to me. I was just a shell. And so it really was about finding, what does Polly like to do, reconnecting with some friends, finding that network. And, the one thing that I can say that OSIS has given me is it's given me my support system with my colleagues and people that have walked the same walk, because it's really difficult to tell someone that wasn't in the military or isn't married to someone what's going on in your house. They're like, oh my God, you need to leave him or her. they're just crazy, or, you know, you don't need to put up with that stuff. And again, I'm not saying you should stay in an abusive relationship. That's not what I'm saying, but they don't understand that there's a whole bunch of stuff that goes with that, right? So when we're venting to someone that understands, and Diane can relate to this because she's been to retreats and she, you know, she goes to the group stuff. It's just that sense of community. So the community that you once had in the military that was like your family away from your own family for just day-to-day military stuff, right? Now you have that, but on the other side of it, in regards to the mental health piece. And so that understanding and that love and that support system, and that acceptance with no judgment.
Yes. Yeah. I want to ask, you know, because I think it's really, you know, I want to come to a turning point here for a minute here, and I want to talk about the positives that have come out of this, because I think what's so important for people to understand, and again, disagree with me if it doesn't resonate with everybody, but I think that there can be a lot of strength in getting diagnosed with a mental illness and working on that journey to, I don't even want to say overcome, because it's a lifelong journey. Tell me about some of the strengths that you've learned, or some of the positives that you've taken away to help you realize that you're not a victim and you're not defined by this mental illness. Tell me about some of the key takeaways that you've learned from having gone through these experiences. Diane, we haven't heard from you in a while. Let's come to you.
Oh yeah. I think with Tammy and Pollyann, they gave us vocabulary, words, ways to say something. I wasn't stuck inside myself anymore. And when I first started this journey, everything was angry. That's the only thing I had. Happy, sad. That was it. And I learned there's so many other words. There's a whole wheel of words. You know, maybe I'm not going to kill somebody today. I'm just pissed off. And that's good. You can be like that.
Mhm.
That's normal. And I found that more than likely I'm normal. There's the odd day, but there's a word that covers it.
Good.
And just to see that pretty happy face there that knows exactly what I'm talking about. And
Mhm.
Sherry, to be able to look and talk to your daughter, come on, how important is that? They taught us how to talk to each other
That's amazing.
without being railroaded, without being victimized, without being, you know, I'm free now to be me. Thank you very much. Thank you very much. And that's all I have to say about that.
I love that. Thank you, Diane. Sherry, you've gone through some pretty traumatic times in your life, having two parents who didn't know how to cope. Tell us about, you know, what you've learned about yourself and the strength that you've taken from that, and, you know, looking back and realizing what you've overcome. What have you learned about yourself?
That's a really big question that you're asking me right now.
I'm sure it depends on the day too.
I think I'm going to focus more on what it's done for me to see mom and dad.
Okay.
Because it was as if a weight was lifted from them, and they were no longer stuck.
Mm.
They weren't spinning their wheels anymore. They were actually able to move forward. And that's not to say that there was days that they didn't step back, but it was they weren't stuck anymore. And I think, you know, just looking at myself, it's just one day at a time, and trying to flip the script in my head that, you know, in terms of any anxiety or the worry or that fear, you know, what if this happens? What if this happens? Well, what if it doesn't happen? And, you know, what is the track record? It hasn't happened yet. So, but it's a everyday ongoing homework.
Mm-hmm.
She also works in ICU every day. So
Yeah, I know you have a whole other layer of things going on right now that maybe we'll come back to on another show.
Another day.
Yeah, Rich, you've been through so much. You've changed so much. You are out there in the world helping others to learn how to cope. Tell us about, what you've learned about yourself and some of the strength you've taken away from this.
Sure. If you remember, Polly said that when you have PTSD, everything gets blamed on it. So that was very much me. And I was, every time that I had like a symptom, it was a complete failure of my therapy, of the faith that people had in me to try and get better, of my own like I thought in my head, I want to get better, but then when I have symptoms, obviously I'm not doing the therapy, and so I'm not even trying here. What's the point, right? So that sounds negative. I'm going somewhere nice with this. So I learned how to forgive myself and how to accept a little bit of flaw in myself. That's okay now. And that makes life a lot easier, man.
I can imagine. Yes. Thank you. Thank you for that. That's a great piece of advice. That's a great piece of advice to us all. Thank you. Tabitha, tell us about what you've learned, what you take away.
I think there's so many positives that come out of it. And I know it sounds ironic because, I mean, do I wish PTSD on anybody? No. But I am resilient now. Was I back then? No. Was I I was an ostrich. I put my head in the sand and that's where I was staying. But now I am resilient. I'm strong. Like, you can throw anything at me and I might crumble at the moment, but I'm going to be able to put myself back together really quickly. Or I can handle it in the moment and then go to therapy and deal with all the emotions that actually come with the big things. And back then I handled it, but then everything else went away. And I think that it took me a really long time to accept my diagnosis. And that's something that is also very hard to admit, because one, I was a medic, so I had an understanding. Two, I did 2 placements as a social work student in mental health. I actually worked at the military mental health clinic for 4 months. So I actually saw PTSD. I knew what PTSD was. And I also worked at a domestic violence clinic. So I saw different anger and coping skills. And I did all of those before my diagnosis. And so it took me a really long time to accept it. But once I accepted that diagnosis, it changed everything. Mm. There are days where I don't want to accept it still. So just so everybody knows, it's a journey. Some days you're just like, nope, today I don't want to have PTSD. But it gave me so many tools and skills, and all of these skills that I was learning while doing these student placements. I actually can apply them now, and I actually understand how to implement them. And there's just so many things. I know how to do boundaries now. I don't let people walk all over me. I don't make people walk on eggshells anymore, and I won't tolerate walking on eggshells. There are so many things that have come from this, that even though for the first while I went kicking and screaming, now I really, now I get to do things like this and help other people learn. And I also volunteer with OSIS and kind of help normalize some of the things that other people are experiencing. Mm. And if I didn't have PTSD, I wouldn't be able to do these things with these people. And it just opens me up to this world that even as I was doing all these mental health things, I couldn't truly understand. And now with this diagnosis, I actually can sit down with someone and truly be like, okay, maybe your symptoms are the opposite of mine, but I actually know where you're at right now, and I can be there too. And I was there. And so, is it a blessing? No. But can I make lemonade out of lemons? Absolutely. And that's the thing is I've got so many skills from it that I would never have gotten. And I've met so many people that I would have never met had I not been on this journey.
And Polly, what about yourself? What have you kind of taken away from your journey, and what's the positive twist for you?
Positive twist is I have a job that I love every day, and I get to meet some incredible people that are trusting of me to be vulnerable with me. And that to me is a blessing. And are there days that are tough because I still live with PTSD within my household? Absolutely. Do I have to be reminded to take care of myself? Yes, absolutely. But, you know, I love my work. And my spouse and I have a phenomenal relationship that we would never have had we not gone through all of these trials and tribulations. We communicate so much better. We've done so many different programs. One, because, well, he's a veteran with PTSD, so, you know, we're eligible. Two, because I always want him to be a guinea pig so I can tell my peers about it. So there's always a double reason, but, you know, my kids have benefited from it. They have a great relationship with their dad. I mean, do they have their days? Absolutely. You know, is there impact on them? Yes, absolutely residual. They're adults, and, you know, that's a whole another episode to talk about. But, you know, in the grand scheme of things, I wouldn't change anything in my life because I'm who I am today because I went through this journey of PTSD with my spouse.
I want to close this off. We're already at 10 after 9, and but I'm reluctant to end this because everything that you guys are saying is helping viewers that are going through the same thing that you guys are going through and finding strength in your words. But I want to end us off by asking the question, if you could go back, or if you could give advice to somebody who's starting their journey right now, somebody who's just found out that they have PTSD, is probably feeling a little isolated, is probably feeling a little scared. What would you say to them? And Tammy, I want to start with you. What's your words of advice for somebody who's just starting off in this journey and maybe hasn't yet seen the positive sides of things?
Well, typically starting off in the journey is just recognizing the journey itself. I think the awareness was mentioned here earlier. So just, I think, and being able to connect with others. And I think that's the other piece of the theme that I've heard here. And, you know, I'm going to be honest with you, the first place I'm going to send them is to Polly, because she's probably one of the most resourceful people I know when it comes to navigating systems internally and has a lot of experience in doing so. But certainly, I mean, first and foremost, I'm going to make sure there's a diagnosis. I'm going to make sure they're connected with Veterans Affairs. You know, those are the resource supports are the things I want to put into play. And then we can, you know, certainly, you know, kind of navigate the system from there. And I always say, be patient. It's a journey, not an event. And as many of you know, having gone through the journey, if we could do it overnight, we all would have done it a long time ago. I'd be a billionaire with a fancy drink on a yacht somewhere with a whole bunch of robotic army people around me, but we can't. And so I always say that, and the journey is, you know, like any other journey in life, we're going to go through hills and mountains. We're going to take some, you know, 90-degree curves. We're going to do lots of different things, but that doesn't mean that, you know, the journey isn't going to take us to some amazing places. And I think that these individuals here in this room have just explained that more powerfully than I, as a clinician, could ever put out there. That as much as we don't want to experience mental health, we don't want to have PTSD, or we don't want to have depression or anxiety, there are some benefits. And, you know, and if we can use those strengths to our advantage, like I always say, anxiety is the best spidey sense you're ever going to meet, right? But it's when the spidey sense takes you over, you got a problem, right? So it's always about, you know, so just being aware of that. So I say, you know, be patient, be open, be ready for trials and tribulations. And at the end of the day, I always say it's 1 day, 1 week, 1 month. Don't go beyond that, because then you're going too far and you can't control any variable beyond it. So.
Thanks, Tammy. And Diane, somebody who's just starting off on their journey, what are some words of wisdom you could share with them?
Come on, sweetie, we're going to have a coffee. And then put your feet on the floor and breathe. And then give them Polly's bedside telephone number.
Polly, it sounds like we're going to be putting your personal information on our Facebook page tonight. Sherry, what's something that you might say to somebody?
Rich, you touched on it. Just being kind to yourself, because one of the things that we all do very well is self-criticize ourselves for not being resilient, being too resilient, being, not enough. Yeah, I think just be kind to yourself and put yourself first.
Yeah.
Put yourself first.
Thanks, Sherry. Rich, what do you say to somebody who's just starting off?
Sure. I got two things, I guess. The first is sleep, diet, and exercise. The second is if you can't love yourself, how in the hell do you expect to love somebody else?
Yeah.
That's it.
Yeah.
So easy.
Yeah, Tabitha. Yeah, I'm sure. Yeah, it's super easy. Tabitha, what about you?
Just do everything Rich said. No.
Yeah, everything they said. Yeah.
Everything else. I think that so sometimes it's the tough love approach, depends on the person. But I've said this to more than one people. You have to do the work. So this is scary and it sucks, but at least now you know. And when you start to do the work and you actually participate in the work, because there's a difference. Just showing up doesn't mean you're actually participating. Yeah. But once you actually participate in the work and actually fully invest in doing the work, the journey gets better. Yes, you'll be on a roller coaster, on that roller coaster ride. It's not a marathon. It's more like the death race. It's a lot longer than a marathon. You're doing a death race here, and it's going to be all over the place. But if you actually put in the work, it's 100% worth it, and it gets so much easier as you go. The more work you put into it, the easier it gets. Even when the things are really tough and you're going through really hard things, it feels easier.
Mm. Thanks, Tabitha. And Polly, let's close this off.
So I would say be willing to embrace change. Being kind to yourself first and foremost, whether you're the veteran with the diagnosis or whether you're the family member in that survival mode. Look for the resources, let someone help you navigate, because it can be daunting when you're first diagnosed. So, if at first you don't succeed, try again. I can't tell you how many different psychologists my spouse has seen over the years, or like I said, different treatment plans. Even myself, I've been with different counselors, and each one has given me a tool. And then, I was okay. And then I went back, and then there was another tool that I needed to learn. So, you're not going to get everything from one therapist or from one treatment program. So I always describe it as a puzzle, and you just have to figure out what pieces belong to your puzzle, but allow those puzzle pieces to come into play. And they might be things that you didn't really think, maybe it's social support, maybe it's getting active again in activities, maybe it's rekindling things with your extended family, maybe it's meditation, maybe it's yoga. There's a whole bunch of different things out there. So, so try the resources.
Thank you.
There's hope. There's hope.
Guys, you are receiving so many messages of thanks tonight on our Facebook page. People are really taking to heart what you guys are saying. They're talking about how you're helping so many individuals. So thank you so much for being authentic. Thank you so much for being raw. Thank you so much for being brave to share your experiences and being willing to help others. So thank you tonight for being here. Thank you to those at home who are watching.
And thank you for helping people out there too.
This is what we do. This is what our organization is here for, but we cannot do it. We cannot do it without individuals like yourselves. So thank you so much for being a part of it. I wish you all a very good evening, and keep in mind, we will absolutely, this is our second time, there will be a third time. So I will find you all.
Thank
Holly,
you.
thanks for bringing everybody together. We really appreciate it, and have a really great evening. Thanks to everybody who's watching tonight.
Good night.
Thank you so much.
Bye.
Bye-bye.
Good night, everyone. Thank you.